Are you tired of battling relentless back pain that just won't go away? Learn how to identify if a bulge disc is the culprit and uncover a fast, safe solution that can change your life. Are you one of the millions suffering from persistent low back pain that disrupts daily activities? Whether it's sharp pain shooting down your leg or that constant ache around the belt line, this video will reveal the surprising reason behind your agony and the game-changing solution you've been searching for. In this video, you'll discover how to recognize the telltale sign of a lumbar disc bulge and why traditional methods like pills, stretching, or even conventional chiropractic care might not be enough. I'll walk you through a clear, simple list of symptoms to help you pinpoint if a disc bulge is causing your lower back or leg pain. Plus, I'll introduce you to a spinal decompression, a safe and effective treatment that targets disc bulge, disc herniations, and provides the relief you need. I've helped countless patients break free from the cycle of chronic back and leg pain. With 24 years of experience and a deep understanding of spinal health, I am here to share expert insights and practical advice to help you find lasting relief. Stay with me as we explore the signs that suggest a disc bulge could be the cause of your back or leg pain. By the end of this video, you'll not only understand one of the most often misdiagnosed root causes of back and leg pain, you'll also learn a powerful, safe solution that can speed up recovery. Be sure to watch until the end, and I'll share with you my favorite, easy to perform test that can help you confirm if your back pain is coming from a disc bulge. This simple test could be the key to unlocking your path to recovery. Hi, I'm Dr. Cameron, a chiropractor in Lucan, Ontario. With 24 years of experience, I've helped over 11,000 people overcome pain, improve their health, and get back to the activities they love. I'm also a certified spinal decompression doctor. This channel is about providing you practical tips on managing neck pain, back pain, disc bulges, and other spinal degenerative conditions. Before I dive in, be sure to subscribe if you want to discover more tips on how to enhance your well-being and live a more fulfilling life. Low back and leg pain can stem from multiple causes, each varying in severity and impact. Among the worst and most debilitating of these causes are disc bulges and disc herniations. These conditions can be incredibly painful, limiting your ability to perform daily activities and reducing your quality of life. But you can determine if your back and leg is due to a disc bulge. While this video is not intended to provide a diagnosis, it will help you screen for key signs and symptoms. If you recognize any of these symptoms, it is crucial to address them with your primary healthcare provider, who can then work up a proper diagnostic code. Here are 9 signs and symptoms to look out for. Number 1, recurring lower back pain. This is an often overlooked sign of a disc bulge. Low back aches or pains that show up out of the blue and then just go away only to return later again that year. I hear this a lot when taking a history with the new patient. In some cases, people have had this on and off back pain for 5, 10 years before they finally get it assessed. Number 2, leg pain. Sciatica is a sharp pain that travels down the leg, below the knee, and often into the foot. The number 1 cause of sciatica is a bulge disc in the lower back. It's not always pain. In some cases, you may feel a numbness, a tingling, or even a mild weakness in the leg. Number 3, low back pain or aches around the belt line. There's a common misconception about a bulge disc is that the pain has to shoot down one leg and into the foot. This is not true. A common symptom of bulge disc is pain in around the center of the lower back, or pain that travels across the belt line. Number 4, lower back pain that gets worse with sitting. If the pain at your belt line or down your leg gets worse when you sit, then it's likely that a disc bulge is the cause. This is the most common complaint from those who have to drive a lot. Sitting in a car, it tends to cause you to slump, adding even more stress to a bulge disc. I will often hear patients say that they dread having to drive anywhere because it makes their back and leg pain noticeably worse. Number 5, lower back pain or sciatic leg pain that gets worse when you switch from sitting to standing. A common symptom of a disc bulge is that when there is an increase in the lower back and leg pain as you go from sitting to standing, especially if you've been sitting for a long time. The increase in pain is usually only lasts for about 5 to 10 steps before it then begins to ease back to its normal level. Number 6, increased back pain with coughing or sneezing. When you cough or sneeze, the pressure around the disc increases, and this will cause a sudden but temporary increase in your back or leg pain. Number 7, decreased back or leg pain when you're standing up or laying down. Standing tends to decrease the pressure on the disc of the lower back, which will then cause a decrease in the pain compared to when you're sitting. Number 8, pain that gets worse or travels down the leg when bending forward. When bending forward at the waist, there is an increase in the disc pressure, causing an increase in lower back and leg pain. I have spoken with several patients who were told they should stretch the back of their legs to relieve the pain. The problem with this is that it requires you to bend at the waist in many cases. If suffering from a bulge disc, bending at the waist will make the problem worse. Tip number 9, the type and intensity of the pain. Disc pain feels quite different than muscular pain. Typically, disc pain is sharper, electrical-like, and radiates. It also does not respond well to pain medication, whereas muscle pain is more dull, achy, does not travel, and responds better to pain relief medication. There you go. Now you have a thorough list of signs and symptoms that could indicate a disc bulge or disc herniation in the lower back. Now, if you've identified any of these signs or symptoms, be sure to get checked by your doctor for a proper diagnostic workup and spinal imaging. So what do you do if you do have a disc bulge? Now, resting and using ice can help alleviate some of the pain from a disc problem, but those methods, they work slowly. One of the best treatments for a bulging disc or a herniated disc is spinal decompression. What is spinal decompression? How can it speed up my recovery? Spinal decompression is a gentle but effective tool to reduce the pressure within the bulge disc. The cyclic nature of decompression gently pulls on the spinal bones and then releases that pull. The treatment lasts about 20 minutes, and many people will even doze off during the treatment. It is different than a chiropractic adjustment in that it creates a negative pressure in the disc, allowing for the disc bulge to retract back into the disc. In the 8 signs and symptoms that I mentioned above, the biggest culprit to the pain was an increase in disc pressure. Spinal decompression is one of the best tools available to reduce the pressure. It is so effective that many of my patients will receive a reduction of pain by 50 to 90% within a few months, especially if they follow the other recommendations we make to meet their specific problem. And now, as I promised you, our bonus tip. Here's one of my favorite tests to determine if your pain is coming from a disc bulge. It's called the slump test. The test is designed to increase the pressure on the discs of the lower back. Number 1, sit up straight in a straight back chair as tall as you can, and then simply straighten the knee of the painful leg. Rate the level of pain you felt in the lower back and down the leg. Number 2, now this is where the slump test starts. Slump down and look at your belt line and then straighten that same leg. Is the pain in your back or leg worse than when you were sitting straight up? If so, you are likely looking at a bulge disc as the cause of your lower back and leg pain. If this test increased the pain in your back or pain in your leg, then it is a good idea for you to talk to a healthcare provider in your area. I hope you now have a better understanding of your back or leg pain and how to identify a disc bulge as the primary cause. If you found value in this video, please like and share it. This helps the YouTube algorithm show this video to more people who need to see this important information. Now it's your turn. If you have back or leg pain, let me know in the comments. What have you tried for relief? What has worked for you and what hasn't? Share your experience. Remember to subscribe to my channel if you want to discover more tips on how to enhance your well-being and live a more fulfilling life. The next video you should watch is this one. 3 exercises to help with bulging disc. Go watch it now.